In the discussion of VA nurse qualification standards, we have spoken a lot about the grades 1 through 3. So as Lisa put you on the spot, Ellen, can you tell us more about the dimensions of nursing practice?
I can. And you can also see on our slide, we have those listed. As Lisa's already told you, there are 4 dimensions of nursing practice and 9 criteria. So the 4 are practice, professional development, collaboration, and scientific inquiry. The 9 criteria are actually divided among the dimensions, and they provide more detail into the actual expectations and requirements. So we're going to talk a little bit about those, and we've been talking to you about the Title 38 regulations and the policies and all, and now what does this mean to a CPAC RUR nurse? So if you look at that practice dimension, under it, it also has a practice criteria. That addresses how a nurse uses the nursing process in his or her work, whether they're in a direct patient care assignment or a consultant role, such as a CPAC RUR nurse. So think about daily duties. You use clinical skills daily in third-party pre-certification process, denials management, doing service-connected special authority validation, interacting with providers on many different issues. Some of those might be appropriate level of care, complete documentation in the medical record, perhaps peer-to-peer reviews. So RUR nurses serve as that critical link among clinicians, staff, patients, administration, and the insurance company. Under practice, we also have the criteria of ethics, and that is the extent to which the nurse makes decisions and takes actions in an ethical manner. What does that mean to RUR? Well, RUR nurses serve as patient advocates and encounter ethical issues every single day in their work. RUR nurses respond to veterans' concerns. They do clinical review for sensitive diagnosis, release of information, again, another VHA policy and requirement. Also in that SCSA validation that I spoke to. The last criteria under practice is resource utilization. This one probably really hits home with revenue UR nurses. But this speaks to how does the nurse demonstrate organizational stewardship related to safety, effectiveness, cost, while carrying out all their assigned duties. RUR nurses are directly involved in optimizing the potential for recovery of funds that are due to VA for provision of health care services to all of our veterans, their dependents, and others who may be using our VA health care system. I think resource utilization would be a criteria that most all RUR nurses are very familiar and comfortable with. Now we move on to the dimension of professional development. So this includes 2 criteria, the performance and also education and career development. Performance speaks to how a nurse evaluates his or her nursing practice, but also the practice of others, using professional standards and regulations to do so. So not our opinion, but actually basing that on some standards and regulations. How does RUR do that? Well, just a few examples that come to mind might be RUR's rigorous adherence to all VA's policies, especially for privacy, release of information, and meeting external regulatory standards in their daily work. You may not even realize that you do this, but it's inherent in everything you do. Education and career development is another criteria. And this includes the nurse acquiring and using knowledge, both for him or herself or for others. RUR nurses really serve as a resource for clinical and non-clinical staff for education about the revenue process. RUR nurses have a requirement to provide ongoing education and training where clinical related issues have been identified specific to our revenue program. So that's also inherent in your interactions. Lessons that are learned are then shared with target audiences, and it helps to mitigate future issues and bring about improvement. The collaboration dimension includes two criteria: collegiality and collaboration. Collegiality is contributing to the development of others by such activities such as mentoring and precepting, as well as sharing your expertise with others. So RUR positions require, we talked about that advanced clinical knowledge. You have excellent communication skills and management abilities in your day-to-day organizational work. In collaboration, it refers to how does the nurse collaborate with other providers and customers to resolve problems. This is also a part of an RUR nurse's day. RUR nurses use group process when issues are identified and are able to collaborate with appropriate disciplines to pull the right subject matter experts in to bring about improvement in a process or a systems improvement to work toward resolution of that issue or problem. One way could be, and there are many examples, but just one I can think of would be perhaps an RUR nurse identifying that there were changes in a third-party payer's authorization requirements, or perhaps a change in medical necessity criteria and that evidence-based criteria, or maybe new documentation requirements. So they identify the issue, they research the issue, and then share it broadly. So finally we come to the scientific inquiry dimension. This consists of quality of care and research. Quality of care, that's one of the hallmarks of nursing, is care. And that's the extent to which a nurse can systematically evaluate and improve the quality and effectiveness of their nursing practice. So RUR actually promotes improvements in patient care in their daily work utilizing medical necessity standards and clinical guidelines. We don't always think of that in terms of indirect impact that we actually have on the veteran's health care and that treatment going forward. Research, our last criteria, is how a nurse uses research and evidence-based practice in carrying out their daily duties. For example, a CPAC RUR nurse may actually research clinical practice guidelines to validate a certain type of care, provision of care that VA is offering. They might research to support the medical necessity criteria for procedures and or medications, and then use this knowledge to obtain authorization, to use this knowledge to share with others, to be able to converse with providers on these provisions of care. So when you think about the 4 dimensions and the criteria, they apply to all VA nurses, but they specifically also apply to a group of nurses that aren't in a direct patient care environment.